how the inguinal hernia cause, how the mechanism by which they formed is actually related to your development. When you're a baby inside your mother's womb, your testis and the kidney actually develop together. It's called the urogenital system. But because the testis needs a lower temperature to form sperms, in the course of your development, the testis comes outside your body to the scrotum. When it coming along, it sort of travels from inside the body to the scrotum, which is outside the body, through a area called inguinal canal. So with the testis along with it, it drags obviously the spermatic cord and the spermatic vessels. So this inguinal canal, in some patients, the peritoneum, the defect which this goes through, it's closed. Well, in some patients, the defect remains open. It's called patent process vaginalis. So a percentage of about 5% of the general population, they have a patent process vaginalis. And in patients who have this patent process vaginalis congenitally, over a period of years, they can form inguinal hernias. Inguinal hernias can also form because of plain muscle weakness. But why these hernias form, why does the muscle get weakened, is one, like we discussed, because of the congenital problem. The other is because of acquired problems. Acquired problems, like in patients who are smokers, because of heavy smoking, your collagen becomes weak and you form hernias. Patients who are chronically increased intra-abdominal pressure, because of repeatedly coughing, the abdominal pressure is increased. Because of severe constipation, because of enlarged prostate, you are having to strain a lot. So coughing, constipation, straining, extreme obesity, any condition which can actually increase the intra-abdominal pressure and intra-abdominal strain can actually lead on to hernias, especially in patients who are prone to hernias by having a patent process vaginalis, which we discussed. Then of course, in some patients, they can have, in the younger patients, a lot of young patients, they can have hernias without any of these features because of their patent process vaginalis. It just happens that suddenly when you lift a heavy weight or something, they feel like a tear. So when you lift a heavy weight, a tear can occur in your muscles in the patent process vaginalis, and then from that point onwards, you can have an inguinal hernia without any of the risk factors which we discussed before.